You're listening to Beyond Wellness Radio, bringing you the cutting edge in health, biohacking, and sports performance. Stay up to date and listen anywhere and anytime on your computer, tablet, or smartphone by subscribing on iTunes. Catch your host, Dr. Justin Marchegiani, as he answers your burning health questions as well as interviews from world-renowned guest experts. For more Beyond Wellness Radio, go to beyondwellnessradio.com.
Hey there, it's Dr. Justin Marchegiani. Welcome to Beyond Wellness Radio. Feel free and head over to beyondwellnessradio.com where you can access our full podcast transcriptions. While you're there, you can also sign up for our thyroid and female hormone video series. This series goes into the root cause of why your hormones are out of balance. While you're there, you can also schedule a functional medicine consult with Dr. Justin, myself, where we'll dig deeper into the root cause of your health challenges. Feel free and think of sharing this podcast with at least one person. This podcast grows by people sharing it. Sharing is caring. If you can think of one person that can benefit from this information, please feel free and share it. If you're enjoying the podcast, make sure you subscribe on iTunes. You can also click below the video or podcast where you'll see the iTunes review button and leave us a review. You can also sign up for the newsletter at beyondwellnessradio.com where you'll get updates before anyone else. Thank you so much and enjoy the show.
Okay, hi everybody, and welcome to the Health Nets podcast with certified holistic nutrition consultants Mary Vance and Caitlin Weeks. Welcome and thanks for listening. Our goal is to dispel mainstream nutrition myths and bring you the best in holistic health and real food education. So we're really excited about our show today because we have an awesome program planned with our special guest, who's functional medicine practitioner and chiropractor, Dr. Justin Marchegiani, and we're going to be discussing all things thyroid and hypothyroid today. So welcome, Dr. Justin.
Thanks. Great to be here.
Thanks. So I'm going to read our standard disclaimer, and then we'll have just a few brief announcements, and then we have a lot of questions submitted by our listeners, and we're excited to address those, and we want to talk about all the latest cutting-edge info on hypothyroid issues. So just to get started, for our disclaimer, the only purpose of this podcast is to educate and to inform. It is no substitute for professional care by a doctor or other qualified medical professional. This podcast is provided with the understanding that it does not constitute medical advice or services. Instead, we encourage you to discuss your concerns with a licensed healthcare provider. Caitlin Weeks and Mary Vance assume no liability for any of your activities in connection with this podcast. So, hi Caitlin, are you there?
Hi Mary, how are you doing?
I'm good. Welcome back from Algeria and France.
Great, thank you. It was a good trip. I got back yesterday about noon. It was really weird because the whole flight was in the daylight, so you never knew when it was time to sleep, so I never did sleep. But then I went to sleep from about 3 p.m. to 3 a.m., so I did get a lot of sleep, but it was all weird times, and so I'm feeling a little weird today, but I'm ready to talk thyroid as always.
Okay, good. Well, I'm sure you had a great time. And I saw from Facebook you posted some awesome pictures of delicious-looking food. It looks like you were able to eat paleo all the way over in Africa and France.
Yeah, I mean, we were with my husband's family, and they cooked, and they treated me like a queen, so it was great. I ate all kinds of great food, and it was really cool. I'm going to try to write some blogs about it and put some pictures up of all the food and stuff. So, anyway, what's been going on with you, Mary?
Well, on my blog, I just have been in recipe development for this cashew cream that I've been making, which is to die for. So go check it out on my website, which is maryvancenc, like nutritionconsultant.com. Because obviously I do a lot of work with dairy-free recipes, and it's one of the best. Either you can make it either sweet or savory to use as a substitute for either heavy cream or even cheese. So I'm kind of excited about that. And relaunching my website and getting my ebook out soon, so I'll have more details about that coming up. So everything's busy as always.
Awesome. I have a post that I wrote about dealing with seasonal allergies. One of the people we stayed with, she was having all these terrible allergies, and it made me write the blog post about how to help her, even though I couldn't speak to her because she only spoke French. But I thought I'll help someone else with this post because she didn't seem to understand that it wasn't about just pollen, it was much more of a systemic problem.
Oh yeah, we should talk allergies in an upcoming post, because speaking of dairy, cutting out dairy can really help you with seasonal allergies.
Oh yeah, this lady had a lot of French bread and pastries all over the place, so I don't think
when in France,
Yeah.
Do you want to introduce special guest Dr. Justin, and then we have a lot to cover this week, and so we're going to focus solely on talking about thyroid stuff. And I'm really excited to cover all of our content, so do you want to jump right into it and introduce Justin?
Yeah, sure. Justin Marchegiani is my friend for the last couple of years. I met him, I took a class for the Czech HLC, the Czech Holistic Lifestyle Coaching with his girlfriend Shelly, who's now about to get married too, I'm sure anytime now.
You got it.
And so we hit it off right away, and she's like, oh, you have to meet my boyfriend because he's all into this functional medicine stuff. And as soon as I met him, we started talking thyroid, of course, and I learned of his whole story. So he got his taste for health from working in a hospital. He was involved in carrying the limbs out from a diabetic ward, and that really had an impact on him and made him get interested in finding the root cause for disease. And he just couldn't stand to just see these people just getting their limbs cut off. He wanted to find out there must be a reason why this is happening, and to go back and work on prevention. So and like me, he was a personal trainer for many years, and then he became while he was in chiropractic school, so he knows tons about the body and all the systems and how they work together, and especially joints and spine and all that stuff. And he even had his own thyroid problems, and he has an autoimmune condition, which I think he has healed and overcome with natural medicine. So he knows all about thyroid, and he was recently a speaker at the Bulletproof Biohacking Conference in San Francisco, and he's been a guest on the Bulletproof Executive podcast. I think I actually introduced him to the Bulletproof Executive because, I know everyone. And he sees clients all over the world via Skype and in his clinic, which is it's right on the Apple campus, right off the 280. It's a very easy, nice drive down there on the way to Palo Alto. So, Justin, do you have any extra things you want to share about your thyroid or your health journey or your history?
Yeah, basically, I appreciate you guys inviting me on the show. I feel so fortunate because I have so much information to share. And having seen multiple patients, especially in the last month, I feel like I've been a thyroid magnet. But I have multiple patients coming in, and I'm just so disappointed to hear the type of care they're getting from the conventional medical world. At the most, they're getting 1, maybe 2 thyroid tests run, either your TSH or your T4, and then at the most, they're just slapping them with a prescription of Synthroid or levothyroxine, and on the way they go. But in the end, they come back to me because they aren't satisfied because they're still feeling good. Their lab tests maybe look more normal, but they don't feel good. So I just got really motivated because of my own health issues and seeing all my patients and just getting really fed up with the past day response they were getting. I really wanted to get to the root issue. So I kind of dedicated the last 3 to 5 years kind of looking at thyroid and looking at female hormones and the gut and really trying to piece everything together. And I have a really nice video on the thyroid and female hormones on my website at justinhealth.com, and anyone can go there and just subscribe to that and get it free. Just some really good information. I'll try to overlay some of that here on the podcast today.
Yeah, great. And thyroid issues are all very near and dear to all three of us because we've all struggled with hypothyroid, and I've made it a focal point of my practice too, and I couldn't agree more. I think just the way that the conventional medical industry addresses and treats hypothyroidism doesn't really get down to the root of the problem, and so that's what we're really hoping to address today.
Absolutely.
So, Caitlin, I know you have also struggled with Hashimoto's and have really knocked down your antibodies and improved your health a lot too.
Yeah, I had, in 2009, I started to feel really bad. I was working as a personal trainer, and I was working long hours and early in the morning, and I just all of a sudden couldn't get out of bed, and I didn't really listen to my body. I just kept pushing. And I did 2 half marathons, and then I became a vegetarian.
Yeah, that's rough.
For a year. And then I really couldn't hardly get out of bed. I had to drink a whole pot of coffee to even go to work. And I sought help from a conventional doctor. Of course, I had a horrible experience and was told that I was just fine, and then I knew I wasn't, so I kept searching, and I found a naturopathic doctor who gave me Thyroid, and within a week I felt like a brand new person. And I also sought a holistic nutritionist, and she was more of a Weston A. Price person, so I really picked up a lot of information from her, and she was, helped me go follow a lower glycemic diet and reduce a lot of my grains. And then, I kind of fell into the whole paleo world by meeting a lot of paleo people like Diane Sanfilippo. And over that time, when I first got my thyroid antibodies tested, I had actually a normal TSH, but my antibodies were over around 600. And now I've just had a test and they were at 200. So I feel pretty good. All my TSH levels are pretty good too. So yeah, I still struggle with some issues with my health, but I feel like I'm on the mend. It's been about 2 or 3 years now, so I feel like I'm going in the right direction.
Yeah, what's interesting is I just came across an article about why women shouldn't run, and there's a lot of clinical and observational studies that too much cardio can impair the production of T3, which is one of your major thyroid hormones. So I can't tell you the number of women I've had training for marathons that come to me that are really perplexed because they're gaining weight. So you can really burn out your thyroid and your adrenals by overtraining like that.
Absolutely.
Yeah, thanks for sharing your story, Caitlin. But, like I said, we have a lot that we want to cover. So before we get into questions, Justin, I'm curious to hear from you. I mean, number one, I have a bunch of questions, but I just want to know kind of what you think, why you think hypothyroidism is on the rise, and why we're seeing kind of unprecedented numbers of cases of both autoimmune and regular hypothyroid.
It's a great question. Well, first off, almost 30 million Americans, mostly women, actually go undiagnosed every year. So this is like a huge epidemic. And about 90% of those 30 million are actually, their thyroid issue is autoimmune in nature, meaning their immune system's actually making certain kinds of antibodies. It could be anti-thyroid globulin antibodies, TPO antibodies, TSI antibodies. And again, these antibodies are affecting the thyroid gland and are literally attacking it. So what you can see in the conventional medical model, they're not taking this into account, because the same treatment is the same whether it's autoimmune or not. And we know just by common sense that this doesn't quite make sense. The gaps aren't quite bridged in that type of model. So we actually have to look at what's causing the immune system, what's causing the body to literally attack its tissue, because the body is very intelligent, and there is a repair mechanism here. But again, when inflammation goes unchecked, research shows over 8 to 10 years of an autoimmune condition, you're going to eventually have compromised gland function, and you're not going to be able to make the type of thyroid hormone you need to be healthy. So looking a little deeper, like some of the common thyroid symptoms, are going to be your fatigue, your dry skin, your hair, memory issues, constipation, a thinning of the lateral third of the eyebrow. So these are all like your common hypothyroid symptoms. Inability to lose weight as well. And what I find is the common tests run in conventional medicine are TSH mainly, and maybe T4 if you're lucky. So we know there's multiple other tests out there, such as the antibody tests that I recommended. Those are vitally important because if you're autoimmune, how you have to eat is incredibly important. Stress and blood sugar management and adrenal function and gut function, they all play a significant role. And just prescribing someone Synthroid or T4 is not going to fix that. That's the key thing. So like some of these other tests that are really awesome are total T4 and free T4, because we make inactive and active thyroid hormones at the T4 level. Same thing at the T3, free T3 and total T3, and looking how the body's converting T4 to T3. Also, we want to see if we're absorbing our thyroid hormone. Is T3 uptake low or high? Do you know many women actually gain weight on the birth control pill because estrogen from the birth control pill actually decreases the body's ability to absorb and uptake thyroid hormone? Yeah. That's a common thing we see with multiple patients, right? We're getting exposed to estrogens from pesticides, from plastics, from birth control pills, and this is affecting, how we look and our thyroid and our body composition. And again, if we're super stressed, we're going to start making reverse T3. That's kind of our body's way of putting on the brake, slowing us down, and kind of decreasing our metabolism so we don't burn up so fast. So those are kind of the key things. So like the big thyroid pyramid, we see viruses are a huge thing. These infections are like monstrous. If you're a patient that's, done like the nature Thyroid and done a lot of like the nutrients and the gut stuff, I find these viruses, and there's a lot of research showing that mono or Epstein-Barr virus is a common stressor on a thyroid issue, especially an autoimmune hypothyroid. So it's really important. If you're like one of these people that tried a lot of things, you've got to get the infections that are correlated to these thyroid conditions checked. So mono's one. Yersinia enterolytica is a parasitic infection that's commonly associated as well. These are really important, and there are different tests you can do that really kind of figures out, if this is such a potential factor in your case. And if you have history of mono, then it's something you definitely want to see a skilled practitioner and look into.
So, Justin, can you talk about, I know I spend a lot of time, exactly like what you said, like conventional medical treatments don't address the immune component of autoimmune hypothyroid. Right. And we now know, or we do know, that the majority of the immune system is in the gut. So how do you see, people with digestive issues and how that correlates to autoimmune hypothyroidism?
It's a great question. And you know what? Alessio Fasano, he's a pediatric gastroenterologist out of University of Maryland Medical School. He's actually put out a study in the last year basically saying it's almost impossible for an autoimmune condition to occur without there being a leaky gut, meaning gastrointestinal permeability in the digestive tract. And so kind of what happens is we have stress. It could be like infections. It could be food allergens, physical stress. All these different, are three kinds of stress: physical, chemical, and emotional stress. Basically break down the junctions in the gut and essentially start to allow undigested food particles to kind of get into the bloodstream, which then puts a huge stress on the immune system. And some of these proteins, like in dairy and glutens, of course, the surface proteins of those food particles are actually similar to certain tissues in the body. So like gluten's a huge stressor because the surface proteins on the gluten protein is very similar to the thyroid. So again, we start stressing our immune system. We get more of these viruses. We get parasitic infections. We have old latent mono infections. And these all just continue to drive more and more inflammation to the thyroid gland. And one of the biggest things, too, is an excellent study that just came out. I want to say it came out last year in the Journal of Hormone Research. It's called "Why is the Thyroid So Prone to Autoimmune Disease?" And essentially, it talks about high iodine intake, selenium deficiencies, as well as all these pollutants essentially are making people so susceptible. So these are studies in mainstream scientific journals, but it still drives me nuts that the conventional medical paradigm is still, run your TSH, here's your synthetic T4, and that's it. But we know the research is out there. It's kind of just being ignored.
Yeah, the gut connection is really fascinating to me, and just like you said, the level of toxins that people are exposed to. But what do you think the most important dietary changes people can make initially for both hypothyroid and autoimmune are?
Well, definitely one of the first things you got to do is really cut the grains out of your diet. I mean, cutting the gluten out first is a good first step, but really trying to get all the grains out, especially if you're autoimmune. I even recommend cutting dairy out for at least a month or two just to see how you respond, and you can introduce it back later. Cutting out the legumes, cutting out the starches, and really making sure you stabilize your blood sugar. I mean, the research is pretty clear. You make this interleukin called interleukin-6 when your blood sugar is unstable, and that's actually going to increase, thyroid destruction. So you really want to be eating every 3 to 5 hours and really having healthy fats and proteins and getting more of your carbohydrates from non-starchy vegetables. That's super important. That's like a foundation when dealing with any patient. The diet is so important. That's why patients need to be under, strict nutritional advice and seeing a nutritionist or under some kind of support so they're really on track with that.
I wanted to ask one thing. A lot of times been hearing more and more lately about, low carb diets causing people to have low T3. What is your stance on that?
Well, here's the thing. I mean, a lot of that comes back to the adrenals. So we know when you watch that thyroid video I have on my site at justinhealth.com, one of the things shown in that video is that healthy cortisol levels are actually needed for T4 to T3 conversion. All right. So again, T4 is your inactive thyroid hormone. It has to get converted to T3. So cortisol, if it's too high or too low, it's actually going to decrease thyroid conversion. So one of the biggest things I see with low carbohydrate diets is people are very low carb, but they're also exercising a lot, maybe doing their CrossFit or doing interval training and such. That can cause some stress because your body essentially, the carbohydrates are just a little bit too low for your activity level. So I'm a big fan of dosing your carbohydrates based on your activity. So if you're not doing much, you can get away with lower carbohydrate and not have any of those reactions. But if you're doing a whole bunch of exercise, getting maybe just a little bit of safe starches in there could be a good way to mitigate your body going out of cortisol balance. But also getting a good adrenal test can help, because if you're really adrenally fatigued, that's going to be essential to support that as well. So getting the adrenals tested first and then figuring out what your carbohydrate threshold is. It's really individual.
Would you just kind of gauge that on how, maybe how hungry a certain meal made you and how many hours it lasted you or how your energy was, that kind of thing?
Yeah, my big thing is if you're hungry, if you're really tired after a meal, it's usually because of one or two reasons. You ate too much carbs or you just ate too much food in general. So I kind of look at it, looking at patients' food diaries. How do you feel after their meal? You could look at blood sugar readings, 1, 2, 3 hours after a meal if they have a blood glucose monitor. Those are some good ways. And then if you're looking at an adrenal test and you're seeing they're like really, really adrenally fatigued, then you have to take that into consideration, because your adrenals are meant to stabilize your blood sugar primarily. And if your adrenals are super weak, you're going to be really compromised. So you got to be making sure you're having healthy fats and proteins and really going easy with the carbs, because if we're making too much insulin and too much cortisol because we're carbing out, that's going to affect our body's thyroid conversion. So I'm a big fan. If you're really skinny and lean, you could probably handle a little more carbs. If you're a little overweight, you probably got to be a little more careful with your carbs. It's really on an individual basis. There's no absolute or always in that situation.
One more thing I wanted to ask you. So if you were talking about the Epstein-Barr or mono, are those things you can just get tested at your regular doctor, or?
I mean, the big thing is a lot of times they aren't up to date on the research, so they're not going to understand why that's going to affect the thyroid. But they're not understanding how it's connected. So they may just say no because they can't warrant a justification for your insurance to cover it. So you're best off finding someone that can, run these labs. There's a couple of really good labs I use, and some of them are covered by insurance too. It really depends. And we can run full panels, IgG, IgM's really important to run for Epstein-Barr, because that's looking if it's a reactivation in the virus. We're finding a lot of these Epstein-Barr viruses are becoming reactivated. We're finding a lot of parasitic infections. And endotoxin from bacterial overgrowth actually flogs the thyroid as well. So looking at the gut and looking at these infections, there's a strong infection connection with the thyroid. And for patients that have done everything and their thyroid hormone's good and they're doing all the things and their tests are good, my biggest thing is you got to look and make sure that infection is addressed.
But, I mean, how do you specifically address the infection directly, or do you just support the immune system? Or is there something aside from just, addressing adrenals and gut health?
There's a couple different things. There's some blood markers. CD57 is a really good blood marker to look at, and if it's low, it's a good idea to support that. And you can do specific mushroom extracts. I use some protocols to help wipe out viruses using a high dose of monolaurin extracts with specific antiviral herbs and botanicals that work very well.
Oh, interesting.
Yeah, so there's some lab markers you can do that really kind of give you a good idea if this is actually happening and present. And some of these protocols just work very well. Also, patients that are autoimmune or have hypothyroid issues, they tend to have a vitamin D polymorphism issue, meaning they actually need more vitamin D than the average person. So we know, like, if your vitamin D is low, vitamin D has a direct effect on your immune system. So getting that vitamin D up, 70, 80, 90, right around 100 is going to really help your immune system as well.
Mm. Do you have any other questions, Caitlin, or should we go into our reader questions?
I think we should go into asking the first listener question. We solicited a lot of listener questions from our Facebook pages. So go ahead and start with that, Mary.
Yeah, I could talk about this stuff all day. It's really fascinating, and I have so many people coming to me with these kinds of questions that I got a lot of really good ones from my Facebook page and through my website. So the first one is kind of what you alluded to earlier, Justin. This one comes from Vanessa. She says, I have confusion around thyroid tests, especially in dealing with conventional doctors. What test do I ask for? And how do I get them when doctors refuse or tell me that they're not needed?
I think you need to find someone that you can work with that essentially can get those tests for you. I mean, my biggest thing, doctors essentially, they tend to be working for the insurance companies most of the time. I don't mean that as a negative against them, is that the insurance basically dictates what tests they can run, and if the insurance covers it, they run it. If it doesn't, they don't. So it's not that they're out to get you or anything. It's just the insurance model is set up where it's a 3 to 5 minute visit. You have to have a diagnosis. You have to have a medication, and that's it. So in the conventional world, it doesn't quite fit. You have to go see someone, a natural functional medicine doctor like myself or you girls as well, that can run these tests. And the tests I like to run, TSH is important, T4 total and T4 free, T3 total and T3 free. Reverse T3 is really important. T3 uptake is really important. And all of the antibodies are vitally important. And I'm also a big fan of looking at total T3, reverse T3 ratio. That's a really nice one to look at as well.
Great, thanks.
But these tests can be ordered all over, they can be done all over the country as well. I use a couple of different labs. I use LabCorp as well. So the test access is there, and they can totally be done.
I've used a lot of ones, I know Mary has too, at direct labs. I mean, just for ourselves, anyone can go there. You order it online, and then you print the form, and then you take it to direct labs. They work with LabCorp. A lot of the labs where you live, it doesn't really matter. You can find a lab that they work with. You just take the form, they run the test, and then you have that power. You can just take that and show it to your doctor, and you already have the information. So they can't say, oh, well, we're not going to run this test, because you already have the test right there in your hand. And a lot of times I've had experiences where that gave me a real leg up with the doctor.
And shockingly, you can get the thyroid panel special on directlabs.com, which is just T3, T4, and TSH, but sometimes that's enough to monitor long-term if you're not, starting out, but that's like $80. And if you go through your doctor and insurance won't cover it, they'll charge you 2 or 3 times that. So, yeah, like having that knowledge is really good. And that's what I use to monitor my numbers too.
Yeah.
Exactly. And I'm a big fan of, and this is the one thing, I'm having a hard time seeing direct labs do reverse T3. I think that's a really invaluable one, because that talks about kind of active stress, kind of how is your adrenal gland stressing, how's stress in your life right now. That's a good one to look at, and I feel it's probably the most undervalued thyroid marker in conventional medicine today.
Reverse T3?
Yeah, I'm just seeing it go elevated, and there's a lot of things we can do. It's a big sign of selenium deficiency as well.
Yeah. Huh.
There's an article that Justin guest posted on my site, and I'll link to that in the show notes, and where all these tests are listed, and you can go over. That's a great article that is very popular on my site. So the next question is from it says, can I heal my autoimmune thyroid disease naturally, or is it with me forever?
That's a great question. And now here is where it gets a little technical, because we get into a state of semantics. All right, so for instance, myself, my thyroid markers are they're right in the money. My TSH is about 2.4, my T4 and T3 and antibodies are basically in the negative range. My hormones are in a good range, conversion's good. Now, I'm in a great place right now, all right? I'm happy. Am I cured? Well, it depends on what you mean by cured, because if I went and didn't manage my blood sugar and ate a whole bunch of grains and, maybe went off some of my supplements, those genetics are still there. So would my hypothyroidism, Hashimoto's come back? Yes, most certainly. But the question is, can I manage this state of genetics with diet and lifestyle, nutrition, and functional medicine and be essentially free of Hashimoto's? Yes. So it's yes and no all at the same time. No, it's a state of genetics. That's kind of fixed. But how the genetics are expressed are totally in your control with diet, lifestyle, and functional medicine.
Yeah, I think that's a really great point. I mean, you can take any state of health that you have and throw it in the trash pretty quick if you start staying up all night and eating a bunch of sugar and all that kind of stuff.
The important point is that it totally is manageable. I mean, obviously everybody's so physiologically different, but, exactly what we're talking about is discovering all the underlying imbalances that are occurring to exacerbate it, and getting those under control really can kind of put you into remission.
Yeah, especially if you're supporting the immune system and you're addressing underlying infections. Now, there may be some people that have had an autoimmune condition for a long time where their thyroid, for the most part, may be somewhat destroyed because of the autoimmunity. And those patients may need to be on some kind of a nature thyroid compound for life. And that's okay, but you can still get those thyroid tests into adequate ranges and have you feel, pretty good. So that can totally be addressed. And the big thing is, too, I'm a big fan of Nature Thyroid over Armour, just because Armour tends to have some gluten fillers and some dyes that can exacerbate, the autoimmunity. So I like Nature Thyroid over Armour, just so that's clear to everyone.
Yeah, agreed.
I've heard some people saying that Armour could possibly have gluten. Have you heard that?
Yeah, it does have gluten. It definitely has some corn fillers in it, and a lot of people with autoimmunity, even though it's not considered, the gliadin protein, the protein in corn is zein, Z-E-I-N, and it can still cross-react with people who are gluten sensitive.
Yeah, scary stuff.
Yeah, absolutely.
Okay, so moving on. What should I do about low iron, adrenal fatigue, and how they cause T3 pooling? Which I've never heard of T3 pooling. And what should I do about that? Can you talk about that?
Yeah, so let's kind of hit each question one at a time. So we know to be healthy, we need three major things. We need oxygen, we need glucose, and we need activation for our cells to be healthy. So oxygen is really important, because if we don't have adequate iron, our hemoglobin can't carry oxygen throughout our body. So it's really important. So again, there's a couple different reasons why we could have anemia or an iron issue. One could just be you're maybe vegan or vegetarian and not getting enough animal sources in, and you're just deficient because the nutrition's not there. So that's a pretty easy fix. Definitely I find patients do better on a high quality, animal protein diet. The ratios may shift. Some may do better with more carbohydrates, some less. But the animal proteins have certain essential fatty acids and nutrients like iron and B12 that you just can't find in certain plant sources. So it could just be a nutritional diet thing, and you just look at their food diary and look at a good history, and you know that. The next reason, she could have hormones that are just way out of whack, and she's estrogen dominant, and her progesterone is very low in the second half of her cycle, causing her to excessively bleed during menstruation. And then she's just bleeding too much, and she's bleeding out her iron that way. So again, yeah, you want to go on some kind of an iron supplement. If you're going to supplement iron, I'm much bigger fan of using liver, kind of a glandular liver product with actual liver that's kind of like freeze-dried, over like a ferrous sulfate, because that just tends to cause constipation and such. And then getting the hormones fixed, because that's the underlying cause. The hormone imbalance is what's driving the excess bleeding, which is driving the iron loss. So doing that's going to really address the underlying cause. So that was part one. What was the next part there? It's quite a lot.
She asks, how do iron and adrenal fatigue contribute to T3 pooling and what to do about it?
Now, I couldn't find too much about T3 pooling, but remember, anemia is going to basically decrease oxygen consumption or decrease oxygen transport throughout the body, which is going to affect your thyroid, which is going to affect your adrenals. So if your adrenals don't have oxygen and your thyroids don't have oxygen transport to its cells, you're not going to be able to activate thyroid hormone. And in regards to T3 pooling, I'm not sure if she's referring to reverse T3 pooling, and that's going to just be caused by essentially your body's converting reverse T3 to kind of slow down the metabolism because of stress. And we can see that happen because of selenium deficiencies. We can see it happen with excess insulin or cortisol that's out of balance. So looking at the adrenals and looking at things like selenium, we'll diagnose selenium deficiency based on elevated reverse T3 or even a elevated red blood cell distribution width in the CBC blood test.
Okay, great.
So the next question is, I am 55, going through menopause. I have hot flashes so frequent it's wearing me down. I also have hypothyroidism. I had a goiter at 16. I went through my whole life being told you're fine. I changed insurance and was put on medication. However, I don't see any changes. I work out 4 days a week and I can't lose any weight. Any suggestions? Thank you, Roberta Hamilton.
Got it. So again, she mentioned she's going into menopause. So one of the biggest things I see when patients shift into menopause, they essentially going to rely more upon their adrenal glands for their sex hormone output. So if your adrenals are weak, that's like a deal breaker because you're not going to have that backup generator to help get those sex hormones manufactured. So getting a good adrenal test would be like the first step. That'd be the absolute first thing. And then really getting a full thyroid panel and looking exactly, where she's at. I think you said she had Graves' disease as well?
No, she just says
I think that's a different question.
Oh, okay. Got it. So, yeah, in general, get the adrenals assessed. Get her female hormones assessed as well. Remember, progesterone is an important hormone that's responsible for activating TPO. All right, TPO is the enzyme that essentially helps make thyroid hormone. It helps bind your iodine to your tyrosine to make thyroid hormone. So if our progesterone is way out of whack and way low because of adrenal fatigue and going into menopause, you're not going to be able to really start converting and making that T4. So really getting that addressed and getting the female hormone balanced. And if she's not autoimmune, there may be a need for iodine. Again, iodine, if you're autoimmune, you really want to stay away from it. The research is pretty conclusive. It's one of the major factors of exacerbating an autoimmune thyroiditis. But if you aren't autoimmune and you have multiple blood tests to convert that or to establish that, you may benefit with iodine, but you really have to be under the supervision of a really qualified nutritionist or physician to monitor that, because if you just go on a whole bunch of iodine and you have an active autoimmune condition, it will make things worse.
Well, what do you think about iodine from food like seaweed, or some people use dulse on their food as a salt substitute, or in addition to sea salt, and and also of course fresh wild fish? Do you think that people can get enough iodine like that, and is it safe for?
Well, I mean, the research that originally came out by Abraham, I think in the 90s, showed that the people in Japan were consuming about, I want to say, 13 milligrams of iodine per day. But research just came out in the last few years by a researcher by the name of Nagataki, and he found that it was actually off by a factor of 10. The average consumption is actually 1.2 milligrams, not the 12 to 13. So we originally were kind of a little bit overhyped on iodine to begin with because the research was just off. So we're thinking, hey, we got to have iodine, in the double digits of milligrams, and that's not really quite true. Right now, the recommended daily allowance is about 150 micrograms. So usually if you're in that range, you're going to be okay with the autoimmune condition. My thing is you really want to have someone monitoring your blood labs, making sure your antibodies are coming down. And if your antibodies are still elevated, I would be very careful. I just wouldn't go out and add iodine into your food supplementally with kelp or iodine. You're going to get some naturally. I just wouldn't add anything to it unless I was really carefully monitoring your labs and how you were doing.
Yeah, and that's a really important point, is monitoring your antibody levels obviously will let you know if you're on the right track in terms of, following a diet plan that is excluding any, food sensitivities you have and so
exactly. But one of the key things, though, if you start doing iodine, it can actually suppress antibody production initially. So you may get a false sense of, hey, my antibodies are going down, but it may not. It may be actually causing more harm than good in the long run. So you really want to be careful. And then a lot of people out there are doing these iodine patch tests. The research is pretty conclusive that about 94% of that's actually just evaporated off the skin.
Yeah, that's what I read too.
Yeah, it's not really a good marker. It's nice to to talk about it because it's easy to do, but it's not really a good marker. You're much better off working with someone that's fixing the adrenals, fixing the gut, addressing the infections, addressing your nutrition and blood sugar. And then once you've had that managed for 6 months to 9 months and your antibodies are no longer present, then doing an iodine loading test may be the next step for you. And there's a couple different ways you can do it. So you really want to work with someone that can dose that up perfectly, because some people actually react to iodine, and it's not even because of the iodine, it's because it's having a detox effect in regards to knocking out the bromine or potential the fluorides, these halide compounds that affect your thyroid gland. You're detoxifying these from you. So you can actually have a detox reaction from the iodine.
Wow. Yeah, we could spend a whole program, I think, talking about the iodine issue, because it's kind of controversial. And I know Datis Karazian's book, he spends a lot of time talking about iodine. But then I've seen another camp saying that actually some autoimmune people do okay on iodine. It's just, I think it gets confusing, and you really have to, like you said, work with someone who really knows a lot about this stuff to figure out what's right for you.
Yeah, the only thing I would say right now is kind of an absolute off the bat here, is if you have an active autoimmune condition and you want to do iodine at some point, at least give it 6 months to a year to get the diet and the lifestyle and get the infections under control, and work with someone that's monitoring your labs and monitoring everything before you do that. Because if you're systemically inflamed and you throw gasoline on the fire, it's only going to make it worse. So you really got to be on top of how everything's kind of being monitored and administered.
Yeah, and I want to, before we go on to the next question, I do want to mention one thing. Is this woman, talks about how she's on medication, she's working out 4 days a week and can't lose any weight. And that's often the first reason that people seek out help, is they know they're hypothyroid or they have autoimmune and they're on medication and they might feel okay, but they just can't lose weight. And that's often something that I tell people just to be patient, and you tend to have to put that on hold and really address all of these other imbalances first, because a stressed body, or one that is fighting infections, whether it's gut infections or viruses, is not going to be a body that is in fat burning mode. So it sometimes takes months or over a year to really address and reverse some of these adrenal issues and gut issues and infection and virus issues, and stabilize your immune system before you can really bring yourself back into homeostasis and equilibrium and be able to kind of then focus on weight loss. So
absolutely, I totally agree. One of the biggest things I tell all my patients that have adrenal and thyroid issues off the bat is, when you go and work out, when you walk into the gym, you need to feel better than when you walked out.
Yeah.
And you need to feel like you can do the entire workout all over again. If you feel like you cannot do the workout all over again and you feel worse than when you walked in, then you're working out too hard.
Yeah, that's really good advice. I have a lot of people who are doing CrossFit and they feel exhausted after their workouts and think that means they got a great workout, but that means they're just draining their reserves even more.
Yes, and there's also one more thing that's out there, and this is like a huge thing, a big misconception in even the paleo sphere right now, is I'm seeing lots of patients with stage 3 adrenals, hypothyroid, and doing lots of intermittent fasting.
Oh, yeah.
And the big thing is, my biggest caveat, I think intermittent fasting is great. just like CrossFit is great, if you have good adrenals, good thyroid function, and you're already pretty healthy, CrossFit is awesome.
And good blood sugar, too.
Yeah, and good blood sugar stability. Now, if you're same thing, if you're doing intermittent fasting and your blood sugar, you're not stabling your blood sugar 90% of the time of the week, your adrenals are fatigued and your thyroid's fatigued, you may want to wait until you get yourself into a better adrenal or thyroid function before you do intermittent fasting, because I see it being a huge problem with patients.
Great one. Yeah, great point. Okay, let's move on. So this comes from somewhere abroad because she talks about how she's gained 25 kilos. But she says, "Hi, I've had Graves' disease and hyperthyroidism until I had radiation therapy. And now I'm on thyroxine. I've gained 25 kilos and can't get control of my weight. Do you have any suggestions?"
Yeah, well, first things first, we got to look at the infection connection here. So the infection connection to Graves' disease is H. pylori. Pretty significant correlation in the literature. H. pylori infection can, people that have those have an increased risk for Graves' disease. So again, looking and seeing if that infection is still present, that's going to be the first thing. Next, doing a full thyroid panel, looking where you're at. I imagine her thyroid, it's either gone, she may be on methimazole, which is another medication they use for Graves'. But depending on where she's at and what her thyroid's at, it may be worth trying Thyroid. Some patients, again, because the autoimmune condition is so rampant, because the thyroid hormone is bioidentical, that can still ramp up a potential autoimmunity in a small amount of people, and those people actually may do good on a combination of Synthroid and Cytomel, so synthetic T4 and synthetic T3. So if you're one of those people that do react to Thyroid, you may do better on a combination of Synthroid and Cytomel, but you want to combine the two. I would never do Synthroid by itself because too many people just can't convert it.
Yeah, no, because it has to be done in the liver, too, predominantly.
Yeah, 60% of T4 gets converted in the liver, 20% in the gut, and then 20% by adrenals and stress. So it's such a small percent of people can convert T4 to T3. I've met them, and they're like, yeah, this is great, but 99 times out of 100, they're not doing well on just Synthroid.
A lot of times I've heard people say they're on T3 only. What do you think about that?
Now, I actually will use a little bit of bioidentical T3, and the situation has to be perfect for it. So one, we look at TSH. TSH isn't bad. We look at T4 total and T4-3. They're in a really good range. And then we look at reverse T3, maybe a little bit elevated, and total T3 maybe a little bit low. So they're kind of reverse T3 to total T3 ratios off, and a little bit of bioidentical T3 can be used just to help reset that feedback loop. Maybe get the selenium and the zinc and all of the nutrients needed for conversion, but a little bit of T3 can be really helpful. But you have to have someone that's kind of watching your blood tests and looking at the adrenals and working on your diet. You don't want to just do this without having a complete picture, because if you're not assessing, then you're guessing.
Yeah. Gosh, radiation therapy, are they still doing that for hyperthyroid?
Yeah, I mean, the thing is...
That's scary. It destroys your thyroid, doesn't it?
Yeah, I mean, the thing is with that, it's a little bit... I mean, you don't want to have a thyroid storm. It's pretty rare, but they can happen with a severe autoimmune Graves' disease where you're having elevated TSI antibodies, and you could potentially stroke. So you really want to be careful. Refer those patients out to the ER ASAP. There are natural things you can do, like high-dose L-carnitine and lithium orotate can be really helpful to kind of modulate and knock that thyroid down in a really gentle kind of way. So is lemon balm. But again, you always want to refer those patients out because they could potentially stroke, small percent of the time, but use the natural stuff in conjunction and try to hold off on the radiation unless it's an absolute, worst-case scenario.
Yeah.
Okay, so the next question is from Belgium. I'm almost 49 years old, female, with several problems. It's started with depression after mononucleosis, chronic fatigue syndrome, thyroid problems, leaky gut, constipation, a lot of allergies, tired, all this proven. On top of it, I think my adrenal glands are not okay either. In the morning, I feel like a diesel. At noon, I have to sleep. In the evening, I'm on top. How can I reverse all of this? Where to start? What to take? I have cysts and fibrosis in my breast. Who can see the big picture so this can stop? I have all these problems since 2006, and I'm tired of them. I want to be healthy and have a normal life. I am quickly in overdrive, hot flashes, red hands after dinner, cold hands and feet, dry skin, hair loss, still kind of depressed. Best regards. Thank you.
Wow. So there's a lot there. I mean, the biggest thing as a physician, I look at this, you try not to get overwhelmed because there's so many things. And, if you're just kind of doing the replacement, drug symptom model, it's the drug list would be a mile long. So just looking at her off the bat, we know potential infection connection is here. Chronic fatigue syndrome in the literature is a strong connection with mono. So more than likely there's an active mono infection, a reactivation of that infection. So addressing the reactivation is going to be absolutely critical. Doing all the diet and lifestyle things are like a must. Like if you don't do that, there's just no supplement, or drug that can help you out of that. So all the diet, the lifestyle, the good sleep, going organic, avoiding all the inflammatory foods. But after that, getting rid of the infection, looking at the thyroid, looking at your adrenals and all of your sex hormones. There's obviously a lot of female hormone imbalances and thyroid stuff as well. So checking out my thyroid video and female hormone video would be good addendum to it. But getting the infection will be foundational along with all the diet and lifestyle. And then getting your adrenals, getting your gut evaluated, and getting your thyroid evaluated all together will be like paramount.
Yeah, there's a lot going on there. And with the mono, and I think she mentioned chronic fatigue syndrome, I mean, obviously that's all immune system and adrenal, so yeah.
Yeah, and I tell patients like this, just to kind of keep it simple, I tell them, for every year you've been sick or you really haven't felt good, it's probably going to take 1 month to reverse that. So if you have been sick for like 12 years, it's probably going to take a good year to get over that. So just to kind of have people make sure they have realistic expectations about getting better.
Okay, good, thanks. Okay, I think we have time for a couple more. So this one says, I'm currently taking medication for my thyroid and due to a tumor in my pituitary gland. My thyroid numbers were low because of my prolactin, the tumor.
Right.
I had trouble sleeping through the night, so I started taking magnesium supplements, and it helped me very well, but I wake up with puffy eyes every morning. My doctor told me to avoid iodine, and my question for you is magnesium supplement not good for thyroid?
I think magnesium is kind of the least of her worries there. I mean, magnesium is not a problem. Just make sure it's a good product. I like magnesium glycinate with no fillers or binders. So that's fine. That's going to help with relaxation and sleep. But on the bigger side of things, we got some serious hormonal issues. Anytime we see, she's describing a prolactinoma. Usually when prolactinomas occur, it's because patients are super stressed. So what happens is they take a lot of their dopamine, which is a neurotransmitter, and they actually convert it into like catecholamines or adrenaline. So they feel like really stressed and really anxious. So when our dopamines drop and our progesterone drops, these actually allow prolactin to rise. So by addressing the female hormones and addressing the blood sugar, and there's some specific herbal compounds and bioidentical hormone formulas she could use to help get her progesterone back on track and actually knock down that prolactin. I've used Vitex Agnes or Chastry with patients with prolactinoma in the past. They were monitored, but they were on different medications. But I was actually able to use Chastry and knock prolactin levels down just with Chastry alone. But you really want to be working with someone that's monitoring your levels, and you've got to get the female hormones fixed. You got to look at the adrenals, the thyroid, and go back to the underlying infection, because there's always an infection connection. And magnesium would be, let me see here. It's like the magnesium aspect is trying to get your car to perform better by painting it. Painting your car is not going to make it perform better. You have to actually go under the hood and get dirty. So there are more things under the hood that need to be addressed. But magnesium definitely, couldn't hurt and wouldn't be an issue in this.
Okay, great.
Okay, so the next question looks pretty complicated too. Hello, I recently had thyroid lab work done and results are as follows. TSH 0.7, free T4 1.2, free T3
2.2,
reverse T3 26.1, thyroglobulin less than 20, TPO 10. It seems as if my reverse T3 is high in comparison to my pre-T3. Do you have any recommendations of lowering this? I have taken an adrenal salivary test and it showed great results. No fatigue. I also have had my B12 levels taken and my blood and urine, and it is also very sufficient. Not sure what else I can do. Additionally, TPO and thyroglobulin AB supposed to be 0, or is the conventional range sufficient, 0 to 40, less than 35 respectively? I know that the functional range is sometimes different than the conventional range. I have been 100% paleo for over a year and feel great, except for constipation. I deal with this by taking magnesium, but I hate to depend on it. I think my thyroid may be the culprit. Thanks for any insight you have.
All right. So let's dissect this one by one here. So looking at her TSH, she's definitely a little bit low. So I like the National Endocrine Society's range, which is 1.8 to 3.0. So she's 0.717. So we see kind of a little bit of low TSH there. So that's already going to affect the whole downstream conversion. So consider like TSH screaming down to the thyroid, hey, thyroid, make some T4. And then the thyroid makes some T4, and then T4 gets converted in the periphery to T3. So we already have, kind of a lower del Rohr coming from the pituitary to the thyroid. So that's going to affect the whole cascade off the bat. Her free T4 is 1.2. It's not bad. Not seeing a big issue there. Her free T3 is 2.2, and that's where your issue is off the bat. She's not converting her free T4 to free T3 properly. And her test is a little inadequate. She's missing total T4 and total T3. So it'd be helpful to have that in there as well. So right now she's missing conversion of T4 to T3. And then her antibodies look pretty good. So I would want to see a little bit more work to make sure there are no nutritional deficiencies, looking at her diet. So I would do all the things to help thyroid conversion, work better. So looking at gut infections, looking at the liver a little bit deeper, making sure she has all the nutrients, like selenium and all these different things to help with the conversion. And she may be one of those patients that benefits better with a little bit of bioidentical T3 just to get the feedback loop kind of established. And ashwagandha can really help get this TSH reset as well. So a little bit of ashwagandha can be really helpful.
This is a really good question she asked, and I've heard so many different viewpoints. Like when you get tested to see if you're producing antibodies, TPO and thyroglobulin AB are the two main ones, and it's true that there's a conventional range on the test that's 0 to 40 and less than 35. So I've had some practitioners say that if you're producing any antibodies at all and it's not 0, then that means you're autoimmune. And others say that you naturally produce antibodies, but if they're below that range, it means you're not autoimmune. So what do you think about that?
Well, I think like anything in your body's constantly breaking up, and it's basically building up and breaking down. So essentially having a certain level of antibodies is normal because that's kind of how your body recycles itself. Right? It's kind of like intermittent fasting in a sense. You go through cellular autophagy and recycle proteins and stuff. So I don't see that being a huge issue. Just keeping an eye on it can be a really good idea. I like at least 3 or 4 negative, autoimmune tests or antibody tests before I conclude someone may be, antibody free. But I do think a certain level is normal. Yeah, I'm not really fanatical about that. I'm open to changing my opinion, but just keeping an eye on it, looking at the clinical presentations. We know this girl's TSH is off, and she's not converting T4 to T3. She's also missing her T3 uptake, so she may not be absorbing her T3. We see patients overabsorb T3 if they're PCOS or high in testosterone. We see lower T3 uptake when they're estrogen dominant or on birth control pills. So we don't even know if she's absorbing it and uptaking it properly. So she's missing a few tests on here to really be sufficient.
So if you're diagnosed with primary hypothyroidism and autoimmune isn't an issue for you, do you see people that can lapse into autoimmune, or do you think that the actual underlying infection is what triggers the hypothyroidism?
Well, we know, for instance, with mono, with Epstein-Barr virus, that the lymphocytes literally infiltrate the thyroid gland and basically start the whole immune reaction. We know iodine will increase B-cell lymphocytes in the thyroid gland of people who are autoimmune as well. So the infection connection is still there. We know the immune system goes through ebbs and flows, like it's kind of going up and down, kind of like a roller coaster ride. So we want to take a look at that and make sure that we're, not catching it in a good day or a bad day. But there's also research out there on PubMed with, the correct selenium protocols can actually suppress antibodies and help with that and help lower the antibody reaction. There's actually a study, let me see it. It's a study from the journal Thyroid, 2010. It's called Selenium Supplementation in the Treatment of Hashimoto's Thyroiditis, a systemic review on a meta-analysis. And basically the conclusion was selenium supplementation is associated with a significant decrease in TPO antibodies in 3 months and significant improvement in mood and or general well-being. So there are things we can do to help knock that down in a good way. And infections and the nutrition are vitally important.
I had one question. I know you were always saying she, and I know why you're saying that. I mean, some of these we didn't get all the names, but most hypothyroid and Hashimoto's is from women. But I hear more and more men on a lot of the groups on Facebook and stuff like that are getting the same problems. So what do you think is the reason that more men are getting Hashimoto's and things like that?
You know what? I'm one of them. I'm one of these men that have one of these infections or the autoimmunity that I'm keeping essentially at bay through all the things we're talking about. I think a lot of it just has to do with the journal article that I talked about earlier, is that the thyroid is just very prone because of all of the different toxins and all of the different things in our environment that are putting us at risk. Now, I think women are more essentially at risk because of their hormones. I think estrogen plays a huge role in affecting thyroid. We know hormonal imbalance is vitally important. We need healthy progesterone levels to make thyroid hormone. And if we make too much estrogen, we can cause decreased absorption of thyroid hormone. So we know that progesterone-estrogen balance is vitally important. And women have this beautiful symphony throughout their cycle. And if that is off a little bit, that's going to correlate and affect the thyroid directly. So that's why women are so much more affected, is because men don't have this symphony of hormones cascading throughout their body every month. They're a little bit more flatlined, and women have a lot more moving parts, so to speak. So that's why they're more at risk. But again, the men are still at risk because of all the environmental stuff, and our immune system is just so stressed nowadays.
Yeah.
What do you think about fluoride? I mean, I've had people tell me that, fluoride is the missing link, and, how can the average person reduce fluoride?
Well, I think just getting a really good water filtration system. I mean, you can just start and get like a really good gravity water filter. I carry a couple. Ultra Pure is a good one. Big Berkey is a good one. Those are just gravity water filters. They're pretty cheap, couple $100. Aquasana makes a couple of really good carbon filters that get fluoride out. It's definitely worth the investment because the type of fluoride that we're being exposed to, isn't the kind of fluoride we find in our environment. It's not, the natural calcium fluoride. What we're finding is it's basically hydrofluorosilicic acid, and it's a halide. So it's, if you look at it in the periodic table of elements, it's right in the same column as iodine. So it can affect thyroid synthesis. It can affect the ability of thyroid hormones being made. We also know in processed food, like grains and bread products, a lot of bromines being used. And if you look at the periodic table of elements, bromine's right there in the halide category, so that can kind of go in there as well. So I think it's bromine and fluoride are both issues. Now, I think nothing's the missing link. There is no absolute. It's really a combination of things, and it's being a really good doctor or nutritionist to kind of figure out what those core things are for the patient you're treating.
One more thing, just kind of give us, like, for someone who has Hashimoto's, what are just some basic supplements that are kind of safe for everyone to kind of, general set of things they can take?
That's a great question. So the first thing I'd recommend if you were Hashimoto's is I would recommend 200 micrograms a day of selenomethionine. So this is just a form of selenium that it's probably the best one out there. Now you don't want to go over, Chris Kresser's put some information on about this on his blog. You don't want to go over about 750 micrograms to 1 milligram. So I just keep it at 200 micrograms per day. That's a good dose. And it's a dirt cheap supplement. I mean, it's, you're looking at like $10 will get you like a 3-month supply. That's a really good product. Just make sure it's selenomethionine. Your next big product is vitamin D. That's another cheap one. I'd recommend getting your blood test monitored on this, but I'm a big fan. You can do 2,000 IUs per 25 pounds of body weight.
Wow.
All right. So if you're 200 pounds, you're looking at about 20,000 IUs. I would do it for a month and then get it retested. Run a 25 hydroxy vitamin D and get it retested. The big thing is the autoimmune conditions, they have a vitamin D polymorphism, so they just need higher amounts of vitamin D. So that's 60 to 100, 70 to 100. I think the units ng per ml is where you want to be. But don't go longer than a month without getting it retested. That's a good starting dose off the bat, though.
What about
So vitamin D and selenium would be a really good one. What was that, Caitlin?
zinc or?
Yeah. I mean, a really high quality multi that's going to have, good zinc. With the zinc, it's really nice. You can do a zinc thalia test. You can get the zinc sulfate. And kind of how that works is if you taste it and it tastes kind of good, it's probably a zinc deficiency going on. If you drink it and it tastes kind of like dirty and sour, then you're probably okay. So that's a really good objective test to kind of look at your zinc status, but a really good multi. I recommend, working with a good nutritionist and a good functional medicine doctor, because there's a lot of crappy supplements out there, and a lot of them can have fillers and stuff that may exacerbate your autoimmune condition. So you want to make sure you're working with someone that can recommend really good products, because the last thing you want to do is take a product that has gluten or some kind of binder or filler in there that's going to be making your autoimmunity worse at the same time.
Or corn derived. So many of them are corn derived.
Or corn derived, and also fish oil is going to be good. But those would be your your real specific ones off the bat. And to go into any more details, you really want to get assessed first, because I mean, the only supplement that's the most expensive supplement is the one you don't need and the one you aren't absorbing. So if you're really being assessed properly and you know what you have a need for it, then it's definitely worth the value of keeping that in your health protocol.
Perfect. Great.
One more thing I thought of is, some people, there's this idea that the probiotics or probiotic foods especially can be the wrong types of bacteria and can make things grow out of control. What do you think about fermented foods and kombucha and stuff like that?
Yeah, I think healthy bacteria is really important. Research shows about 28% of your thyroid hormone is actually converted by healthy gut bacteria, such as sulfatase. My theory is on this. It's really simple. If you're going to get your car washed, you always get your car washed before you get it waxed, right? You don't wax the car and then get it washed. So my thing is, if people's got their tummies full of gut bugs and infections and they have dysbiotic bacteria, I'm a big fan of get your gut cleaned out first. See if there's an infection. Get it wiped out. And then once it's all cleaned up, then add all the good probiotics. If not, you're just waxing an already dirty car.
That's great. Do you have anything else you're thinking of, Mary?
Well, no. I think we pretty much hit the high points. I mean, like I said, I could talk about this stuff all day. But we'll probably have to have a part 2 at some point. But we really appreciate all your information, Justin. This has been really fabulous, and I think everybody, especially you, did a great job of answering all the questions. So let people know where they can find you and how to contact your office if they want to work with you.
Great, yeah. Feel free to go to justin health HEALTH.com. I strongly recommend anyone get the female hormone report as well as the thyroid report video, because they both connect. And it's really important. If you understand the female hormones and the thyroid together, you see how there's a synergistic link. So that's a really good place just to get some great information. Right now I am doing some complimentary initial consultations for patients that fill out a metabolic assessment and fax over their lab work. So we can take a look at it, and we can at least give you a good place to start and answer any questions that they may have in regards to their specific case. But that's a really good place. Next is read Dr. Nicholas Hedberg's book called The Thyroid Alternative. It's a really great book. He's a big mentor of mine, and he's another great expert in this field, Dr. Nicholas Hedberg.
Yeah, that is a great book. I like that book a lot.
Yeah, he's a great guy too.
Yeah, so please share our podcast with your friends and leave us a review on iTunes if you have enjoyed this podcast. And we will have notes so that you can skim through our site on this posting and see the notes for things that we mentioned. Anything else, Caitlin, before we wrap up?
No, that's it. Thanks so much for listening, and you can find more information on our blogs.
Yeah, I'm at maryvancenc.com and Caitlin is grassfedgirl.com. So until next time, thanks so much, Justin. We really enjoyed having you on, and can't wait to share all this information with everyone.
Yes,
Thanks, Mary and Caitlin. It's great to be here.
All right.
Thank you.
Bye-bye.
Bye.
Got a question for Dr. J? Go to BeyondWellnessRadio.com and click the questions button. Then tune in to hear the answer. Also, if you like the show, click below to review us on iTunes. For more Beyond Wellness Radio, go to BeyondWellnessRadio.com.